Everything seems to be fine. So, a very good morning, all of you. Welcome to our day 2 of 21-day challenge, 5 a.m. club. So, it's been fantastic yesterday throughout because we had plenty of time towards various activities as we started our day very early. In fact, I got some feedback from some of the students saying that they had time for various other activities along with preparation, which is a fantastic sign. So, day 2, so we're continuing with our 21-day challenge. So, again, we'll have the same format. We'll have a general discussion, literature review from one of my favorite books, which I'm reading now. And also, we'll move on to an academic discussion in the form of image-based discussion, right? So I hope everything is streaming fine. So once again, a very good morning, all of you. I hope you guys are all doing fantastic. So let's start with our presentation now. So I know you're all on fire. So day 2, you're welcome to day 2 of our 21-day challenge. So how are you guys feeling? So is it the same scenario? Still feeling a bit sleepy, passive, or are you excited? So once we start inculcating good things as habits, obviously we're in fact directly inviting positivity and enthusiasm into our life. So I hope at least on 21st day after 21st day, you all will be much more excited and enthused, right? So let's start with this literature review from Psycho-Cybernetics by Maxwell Maltz. He is a plastic surgeon by profession, but he has given us in-depth analysis on the psychological aspects of human thinking. So we'll start with this, which is very much relevant to what we are doing right now. That is waking up early in the morning, trying to form new good habits. So what's the basis for all this? The power of deep desire. In fact, if you had noticed, even in last night's Telegram or YouTube message, text message, I mentioned something about a desire. So this is the basis of actually doing something, isn't it? Since you all have the desire to excel in your personal and professional life, you wanted a right start, you wanted a great start, you started waking up early in the morning. So that happens only when you have the deep desire, right, in you. So the power of deep desire, rational thought, to be effective in changing belief and behavior must be accompanied by deep feeling and desire. Picture to yourself what you would like to be and have, and assume for the moment that such things might be possible. Arouse a deep desire for these things, become enthusiastic about them, dwell upon them, and keep going over them in your mind. Your present negative beliefs were formed by thought plus feelings generated through this process. Generate enough emotion or deep feeling, and your new thoughts and ideas will cancel them out. If you analyze this, you will see that you are using a process you have often used before, that is worry. In fact, I mentioned this in one of the recent videos, 250 days before need. The only difference is you change your goals from negative to positive. When you worry, you first of all picture some undesirable future outcome or goal very vividly in your imagination, very vividly. You use no effort or a willpower. We simply worry. But you keep dwelling upon the end result. You keep thinking about it, dwelling upon it, picturing it to yourself as a possibility. You play with the idea that it might happen. This constant repetition and thinking in terms of possibilities makes the end result appear more and more real to you. And after a time, appropriate emotions are automatically generated. That is fear, anxiety, discouragement. All these are appropriate to undesirable end result you are worrying about. Now change the goal picture and you can easily generate a good emotions. Constantly picturing to yourself and dwelling upon a desirable end result will also make the possibility seem more real. And again, appropriate emotions of enthusiasm, cheerfulness, encouragement, and happiness will automatically be generated. In forming good emotional habits and in breaking bad ones, said Dr. Knight Dunlap, we have to deal primarily with thought and thought habits. As a man thinketh in his heart, so is he, man or woman, or humans as such. So the basis of any of our actions is the deep desire, which actually helps us in actualizing things, right? And most importantly, there is something very interesting to know about a worry. So if you carefully observe, we worry because we are picturizing the end result as a failure. So we have that very clear picture that we're going to fail, people are going to talk things, we're going to feel bad, there will be so much of pressure. What will I do if I fail? So the picture is very clear, the end result is very clear. So that actually leads to worry. And your mind gives you appropriate emotions as feedback because of that worry in the form of disappointment, discouragement, or negativity. The moment you change your goal picture, as clearly mentioned in the literature, imagine yourself to be successful, imagine yourself in a position where you wanted to be or where you want to be, then appropriate emotions will be fed into your mind. That is positivity, enthusiasm, excitement, and the feeling of satisfaction the moment you accomplish those tasks or goals. It cannot be more true, isn't it? So, with that general part of discussion, now let's move on to the academic part. I hope you guys are able to follow, and I hope you guys are all wide awake. And also, I hope that brushed your teeth. Okay, fantastic to hear that you're excited, not feeling sleepy. Right, now let's move on to our academic part of this live. So this time what we'll try to do is we'll discuss some images and then I'll ask you one related question. Okay, so last session I asked you a question and then we moved on to a discussion part. We'll do it reverse this time. So observe these images very carefully. So, you know, muscles of mastication, which is obviously a very important topic. So you can see various muscles of mastication and also their corresponding actions in the form of arrowheads. So those you can see in bold, they are primary muscles or principal muscles of mastication, and others are accessory muscles of mastication. So let's review the origin and insertion as well as a nerve supply, including the actions of these various muscles of mastication. The most important reason for posting images rather than text is to make sure that you're visualizing them, which makes it easy for you to remember at a later date any question or any topic related to these muscles of mastication. So observe carefully, starting from lateral pterygoid, and then we'll move on to medial pterygoid. So lateral pterygoid, as you can see, it is short, thick, and conical. Observe the shape of the muscle also, lateral pterygoid, short, thick, and conical. The origins are not very clear in this illustration, but I'll give them out for you for sake of completion of this topic. This lateral pterygoid originates from, it has two origins. One is upper head from infratemporal surface and the crest of greater wing of sphenoid. And the other origin is lower head of lateral surface of lateral pterygoid plate. Lateral surface of lateral pterygoid plate, hence called as lateral pterygoid. And if you look into the insertion, which is very clear in this case, pterygoid fovea on anterior surface of neck of mandible, and also articular disc and capsule of TMJ. So there are actually two origins and two insertions. And if you observe the action, right, you have arrows which are represented in red. It helps in protraction and also depression of mandible, right? The principal muscle which helps in opening the mouth. So depression of mandible by pulling the neck of the mandible forward due to its insertion and also protraction. Now let's move on to medial pterygoid. Again, the origin is not evident in this illustration. I'll give it out to you for sake of completion. So as you can see, it is quadrilateral in shape, medial pterygoid. Quadrilateral, just like your masseter, both masseter and medial pterygoid are quadrilateral in shape, 4 sides. So the origin is superficial head from maxillary tuberosity or tuberosity of maxilla, and the other origin is deep head from medial surface of lateral pterygoid plate. So if you observe, both lateral pterygoid and medial pterygoid are originating from lateral pterygoid plate. One from lateral surface, other from the medial surface. I do not bring medial pterygoid plate into the picture here. And if you look into the insertion, so medial surface of an angle adjoining the ramus of mandible. So that's the insertion of medial pterygoid. And what's the action? Again, like lateral pterygoid, medial pterygoid helps in protraction of mandible and also elevation of mandible, but not depression, right? So these are origin, insertions, and relevant actions of lateral and medial pterygoid. We'll summarize them again at the end of this session, so don't worry, even if you find it confusing. Now, moving on to next muscle of mastication, temporalis, fan-shaped, as you can see. So fan-shaped muscle. Origin is a floor of temporal fossa and also temporal fascia. So 2 origins, and insertion, tip, anterior border, and medial surface of carnoid process, as you can see. And also another insertion is anterior border of ramus of mandible. So just observe these illustrations. You'll obviously understand it, and you'll in fact remember it very easily. And coming to actions, helps in elevation of mandible. In fact, we've seen arrows previously. Elevation of mandible by anterior and middle fibers, and retraction of mandible by posterior fibers. So elevation and retraction. Okay, and then moving on to the next, the final primary muscle of mastication, that is masseter, as we discussed, quadrilateral in shape. You can see 2 origins, origin from zygomatic arch and also the maxillary process of zygomatic bone highlighted in red, and also insertion on ramus and carnoid process of mandible, right? So origin insertions are very, very important. So insertion of masseter, as we mentioned, lateral surface of ramus of mandible and carnoid process. And what's the function of this masseter muscle? Elevation of mandible to occlude the teeth with forceful bite, right? So this is the overview of various muscles of mastication. And those which are not in bold, they are accessory muscles, right? So muscles of mastication, if you observe, or if you have an overview, these are concerned with movements of mandible at the level of temporomandibular joint, which is very, very important. And also they are located more or less in or around infratemporal fossa, and they're inserted into ramus of mandible, more or less. And all of them are innervated by mandibular division of trigeminal nerve. And if you observe in the development part, they develop from first pharyngeal arch, mesoderm of first pharyngeal arch. And there are so many important relevant points pertaining to these muscles of mastication if you go deeper. So we'll just stop it here with this overview. So my point is, observe these images very carefully, including the arrowheads. Observe it mindfully for at least few minutes of time, and then close your eyes and try to visualize the same. And there is no way you're going to forget these origins, insertions, including the nerve supply, as we discussed it n number of times in the form of textbook discussion, in the form of development of pharyngeal arches, etc. Right? So when it comes to anatomy, it's all about a visualization. Using visualization, using mental pictures makes a job, and in fact, life very easy during preparation. Right? So these are various muscles of mastication, including their shapes, right? Temporalis, masseter, lateral pterygoid, and medial pterygoid. Now, the question is, let me just come out of this live presentation and let me ask you that question. So the question is, How many origins and insertions do these models of mastication have in general? One origin, one insertion, two origins, one insertion, one origin, two insertions, two origin, two insertions. So how many origins and how many insertions are evident in case of models of mastication? So we'll conclude with this question. You can keep answering it. And what else? Good. So before we conclude, as we have seen previously, starting anything is often very difficult. As I mentioned previously, taking the first step needs a lot of courage. And you've all done that to incorporate this new good habit of waking up early in the morning. We've all done that. So this is day 2. And I don't think it's going to be any more challenge for us to continue with these sessions. So waking up early in the morning for the first time might be very harsh, but as we discussed, it's all about deep desire. So visualize yourself in a position where you want to be. Just analyze why you're all doing this. That itself will give you ample clarity, right? And instead of using our imagination and memory for worrying, for picturing negative results, we can picture positive results. We can use visualization to visualize ourselves in a position where we all dream to be, and that itself will bring all the positive emotions, right? So with this, let's conclude our second day, day 2 of our 21-day challenge. And it's all about working hard, working consistently, and most importantly, believe in yourself. And the moment we conclude this live session, you'll have plenty of time. Just don't sleep. Um, Keep yourself involved in some activity, physical exercise, meditation, any activity based on your choice. And if you feel real sleepy and drowsy, you can try a power nap at 10:30 or 11 a.m. or even the afternoon time, not exceeding 20 or 30 minutes, so that you can sleep early tonight, at least by 10 or 10:30 p.m. and then continue this positive cycle of 5 a.m. club. Okay. So have a fantastic day, everyone. Well done once again. Just keep this consistency and momentum going. Let's all keep this enthusiasm going. Have a fantastic day. Take care. Deepika, good morning, sir. I'm sorry you're late. It doesn't matter. What matters is your participation. Even if you're late, you managed to join, right? Don't worry. And don't use that point as leverage to discontinue what you're doing, right? So it's okay even if it is late. Sometimes they say it's better late than never. Yeah, you too. Have a nice day.